All right, so thanks to those of you who have joined us today for our Impact Education Learning session for Store It Safe. We want to thank particularly CareSource today as they are providing funding for this project. So we really appreciate their partnership and support. Just a brief disclosure that we have. So none of the presenters today have anything to disclose that is relevant to today's content, and there's no off-label products that will be discussed. Our objectives today, be able to describe suicide statistics, identify and be able to use reach skills, and apply knowledge gained in communication with patients and families regarding safe storage options and the importance of barrier methods. We have several presenters with us today. So Dr. Mike Gittleman and Dr. Sarah Denny are both medical directors for the Store It Safe project, and they will be presenting and or answering questions or comments today. Please feel free. We have a very small group, so think of this informally and chat in questions or ask questions as needed. And then we also have several colleagues from Cincinnati Children's Medical Center joining us today as well. Dr. Reel and Dr. March are with us, and we'll be presenting about reach and using a virtual reality platform to help with conversations. I think we have another person joining us too. And I'll let them, when they begin to speak, give a brief introduction about themselves. So with that, I'm going to turn it over to Dr. Denny.
Great, thank you. I was wondering if before we get started, maybe the people who have joined could just say a little bit about themselves and why they chose to join the Impact Project. And if you're logged in, with your team, maybe just letting us know who all's on the call. I'll start with Jennifer Mullen. Do you mind introducing yourself?
Hi, I'm Jennifer Mullen. I'm a pediatrician at Arrowhead Pediatrics in Maumee, Ohio. And just realizing that this is kind of an ongoing this emergence in the community. So we're just
Okay, thank you. I don't know if it's my audio that's cutting in and out, or
I think she was breaking up a little bit.
Okay.
It was on my end as well.
Okay. All right. Courtney Sumner, do you mind sharing?
Hi. Yeah, so I just joined Cincinnati Children's Anderson Primary Care. Prior to working here, I was working at PPC, and so definitely recognize that we didn't have lock boxes here and other things that I usually use to counsel families with. So wanted to jump on board this project.
Awesome. Thank you so much. And then our last person, if you don't mind sharing and introducing yourself.
So this is Therese Lennon, and I'm a pediatrician for Akron Children's Hospital. I work in our Warren office. We do have lock boxes, and I feel like I didn't know exactly how to use or counsel with them properly. So I kind of joined to get a better sense of how to use the equipment or materials that we do have in our office.
Great, perfect. Well, thank you so much. We're really excited to have you join our Impact Project. We have another wave of practices starting in August. So we're super excited about this, and we're really excited to have our Cincinnati colleagues joining us on this education journey. And really, Dr. Lennon, this is exactly what we're trying to get out of it and teach you guys, is like, how do you have these difficult conversations in clinic? So, I'm going to just start, and then I'm going to pass it over to our Cincinnati colleagues. This is, just why are we doing this? Next slide. We all see this every single day. Next slide. Yep, next. So we see the accidental, back. We see all the accidental shootings. We see the suicide. both in our practice, in our communities, nationally, we see these headlines all the time. Next slide. But if you don't already know this, or you haven't already seen this figure, it came out in New England Journal of Medicine. For the first time in 2019, we saw firearm-related injury surpass motor vehicle crashes as the leading cause of death in children and adolescents. So if you feel like you're hearing more about it, the data supports that. Like, you are in fact hearing more about it, because it's becoming more and more of a problem, which is why we feel like in the primary care setting, there's a ton of opportunity to take more action, be more engaged in this topic, have these conversations, and try and change this trend. Next slide. Now, when we look at high income countries, this probably also isn't going to be a huge surprise to anyone on this call, but the US accounts for 91% of children killed by guns. Next slide. I thought that, again, this kind of is a really, I find to be an interesting slide, but it kind of supports that New England Journal of Medicine figure when we're looking at gun deaths of US kids. Again, looking at that 2019, 2021, we saw that there was a 50% increase in gun deaths among US children and teens under 18 in the United States. And so that is inclusive of homicides, suicides, accidental shootings as well. Next slide. And I think that it's really important to mention that there's racial disparity in this injury mechanism, as there are with so many other injury mechanisms in the United States. So when we look at the breakdown in rates, we see that Black children are 5 times more likely than white children to die from gunfire. So just being cognizant of the continued disparities and what can we do to help close that gap. Next slide. Okay. Anyone who has been practicing pediatrics in the last 5 years, whether you're in a primary care setting, whether you're in an emergency room setting, an urgent care setting, it doesn't matter. You know that we are seeing more and more mental health issues, and the access is really challenging. And so we are doing more of this work in, on the front lines. So, as well as I do, that we're seeing more and more of this. And we know that suicide is the second leading cause of death in our 10 to 25-year-old age group. Those are our people. Those rates are continuing to rise, and more people are going to the emergency department for mental health and suicide attempts over the last 2 or 3 years. Next slide. Okay, when we kind of dig down, drill down a little bit more when we're talking about suicide, we know that firearms are the most common method used in suicides. This is just a figure to kind of demonstrate the different mechanisms of suicide completion, and firearms is the leading cause. Next slide. We know that suicide risk is increased when there's a gun in the home. So when we look at just the youth who have completed suicide by firearm, 82% used a firearm from within their own home. Next slide. And this is really the critical piece. And when we're talking about, using those gun boxes, this is your why. When interviews and studies have been done with survivors of near lethal suicide attempts, we know that 25% of those survivors made their suicide attempt within 5 minutes of making their decision to take their own life. 50% made their attempt within 20 minutes of making their decision, and 71% within an hour. So we know that most of these suicide attempts come within an hour of their decision to take their own life. Next slide. Because we know this, we know that barriers are really, really important. Are they 100% fail safe? Not always, but if they can even buy us 5, 10, 20, 30, 60 minutes of time between that person wanting to take their own life and actually having access to a firearm, we've saved a life. So if we can get them past that initial hour, and maybe, hopefully have some other safety planning things in place, then we have really achieved our goal. And so barriers are critically important. It doesn't matter if so-and-so Johnny Smith has always been around firearms their whole life and they know all about firearm safety. It doesn't matter if it's a time of crisis. We need that barrier in place. And barrier means the firearm is locked up, the adolescent doesn't have the key, doesn't know the combination to the safe, like truly does not have access. And of course, this isn't just for firearms, this is for all lethal means. So, over-the-counter medication, other drugs within the house. This is any lethal means we need to restrict access, because we know that if they have access and they're in a time of crisis, time is a really critical component, and having a barrier in place delays their access. Next slide. If this is an area that interests you, I just wanted to share this resource. I think it is really helpful. The American Academy of Pediatrics put this out. It's the Blueprint for Youth Suicide Prevention. And I just pulled a couple of points out that I've included here just to remind us that as health clinicians, we are well positioned to identify and support youth in the clinical setting. And the reason for that and how we can do that is, multi-pronged. One is universal screening, and that's something that we're not going to get into on this impact project that much, but we do in our bigger quality improvement program really talk about the importance of universal screening, and also the universal screening for depression and suicide as two separate screens, because you can be suicidal and not be depressed. And so you really miss a large number of patients if you're only screening for depression. So universal screening is really important. Having standardized clinical pathways. Hopefully today we'll give you kind of some standardized scenarios where you can sort of learn some language and how to have those conversations. And then in the bigger QI project, if any of you decide to go on to do that, we really help guide you in ways that you can put those clinical pathways in place. And then I think too, as providers, we all feel the burden of trying to be all things to everyone. And so leveraging the strength of other members of your care team. This could include, if you're co-located or have integrated psychology, your social workers, like your nursing staff, your MAs, like how can you leverage the strength of all of the care team to help with the screening and identification of youth that might be at risk. Next slide. And this is data that is pulled out of that suicide prevention blueprint that I think just gives us more reason to really make sure that we're screening before or for all kids at well child visits for our adolescents. So 80% of adolescents visited a healthcare provider within the year prior to their death by suicide. 50% had an ED visit within the year. 38% had contact with the healthcare system within 4 weeks of their death. And then when we're looking a little bit at the older age group, 34% had had contact with a healthcare provider in the week before their death. And so again, like making sure we're opening up those lines of communication, making sure that families, number one, are having these dialogues and these conversations ongoing with their kids at home, but also making sure that we're sharing that we can be a resource when they're having struggles as well. Next slide. All right. And with that, I will turn it over. Actually, let me pause for just 1 second there. I can't see.
Yeah, we did have Dr. Morocco joined us.
Oh, great.
So
Okay.
she is on the call as well.
Perfect. Any questions at that point, just kind of on the basic foundational pieces as to, I know you all know why this is important because that's why you're on this impact project, but any questions about what I went over before I turn it over to the Cincinnati team? Okay, perfect. Then I will turn it over to Joe and Michelle. Thank you.
Sounds good. Hello, everybody. My name is Joe Reel. I'm a general pediatrician at Cincinnati Children's. So I work at the Pediatric Primary Care Center, which is our downtown clinic. I have Michelle March with me today. Michelle, do you want to introduce yourself briefly?
Yeah, of course. My name is Michelle March, and I'm also a general pediatrician at the PPC, or Pediatric Primary Care Clinic. And I'm also a research fellow currently at Cincinnati Children's, entering my 3rd and final year.
All right. And if you don't mind unsharing the slides, then I can go ahead and share mine. Perfect. Thank you. All right, so today we are going to focus specifically around communicating with families around access to firearms and safe storage strategies. So this curriculum was a collaborative curriculum that was developed with Massachusetts General Hospital for gun violence prevention. They have a Center for Gun Violence Prevention. So they've been doing standardized patient curricula to teach clinicians how to talk with families about safe firearm storage and have had some really great results. So we partnered with them to create this virtual version that you're going to see today, which will allow an opportunity for us to practice some of these skills. So a few things before we get started. So we did want to take a moment to just acknowledge that discussions around firearms and violence prevention can be deeply personal, that this is a zero judgment zone. Everyone brings their own experiences to this issue. And our efforts here are not about gun control, but rather to educate pediatricians on firearm safety as part of, I think, all of our long-term goal to decrease pediatric morbidity and mortality related to firearms. And this is a simulation session, right? So this is all about practice. It's low stakes. So we're hoping that individuals will be interested in participating today. So let's talk a little bit about some specific communication skills. And as we go through our curriculum over the next 30 to 40 minutes, we're going to focus on screening during routine well childcare as an effort to avoid those accidental type of injuries, and then move towards screening in those higher risk populations, like our patients that have depression who might be at higher risk for suicide. So in terms of specific communication skills, we kind of have two buckets of skills. On the left, we have what we're calling our reach skills. These are going to be strategies to introduce the question around firearm safety and introduce some safe storage strategies to families. And on the right, we have motivational interviewing skills. So let's just start with our reach skills first. And I should say that these skills we're going to discuss today were developed based on a number of different guidelines, including the Storage Safe campaign, the American Pediatric Surgical Association guidelines, and Everytown for Gun Safety guidelines. So the first skill we're going to talk about is something called a contextual announcement. So the idea of this is introducing the topic of firearm safety sort of within our typical injury prevention anticipatory guidance as a way to provide some brief introduction of why this is within the scope of practice for pediatricians. So what might this look like? So as you're talking with families about other safety considerations, such as car seats, you might say something like, you know, I'm glad to hear that Alex is using an age-appropriate car seat. That's great. You know, as part of my safety counseling for all my patients, I also like to talk about household firearms because we know that those compose a safety risk to children as well. So the next skill that can be helpful when introducing this topic is doing something called presumptive teaching. So this is just giving a little bit of information to families around specific safe storage strategies so that they'll be sort of more equipped to answer questions around storage practices. So what this would look like is you make that contextual announcement, introduce the topic, then you might say something like, you know, research has shown, or, you know, we've learned over time that the safest way to store a gun is making sure that it's locked, unloaded, and the ammunition is stored separately from the gun itself. So now the family is kind of well informed around what are some safe storage practices for firearm storage, so then is more capable of answering a screening question. And so the screening question might look like something like, for firearms in your home or maybe other homes where Alex may visit, do you know if the firearms are kept locked and unloaded? So those three steps are sort of the way that we've been teaching our resident providers, and again, pulling from national guidelines as a way to introduce the topic of firearm access, which is been reported as a major barrier for, you know, pediatricians even bringing this topic up in a clinical setting. So why don't we do a little bit of practice? So during this session, we're gonna do some virtual cases where we can practice communicating with graphical avatar characters about firearm safety and storage as a way to sort of reinforce some of the skills that we're discussing today. So any questions about any of these strategies before we jump into a case? All right, sounds good. So I think Michelle is going to do our first case, and then hopefully we can get others to participate in some of our subsequent cases. So for this case, Michelle, you are going to be seeing a previously healthy 5-year-old child named Alex, who's accompanied by her mother named Phyllis for her annual visit. As part of the social history, you learned the patient lives at home with their mom and a 2-year-old sibling. You reviewed everything with Phyllis and are now ready to discuss safety and anticipatory guidance. So you start with car restraints and then turn your focus towards screening for access to guns in the home.
Great.
Let's give it one moment here. Whoops.
All right. Phyllis, I am so glad to hear that Alex is doing so well and is growing and developing very appropriately. Really happy to hear that she is in an age-appropriate car seat. And along the lines of safety, as part of safety counseling for all of my patients, I also like to talk about household firearms, as we know that those can pose a risk to children as well. Research has shown us that the safest way to store a household firearm is locked, unloaded, and with the ammunition or bullets stored separately from the firearm itself. For firearms that are in your home or other homes where Alex may visit, are they locked and unloaded?
That's not an issue for us. We don't have any guns in our home. Thank you for the information, though. I will check with family who watch Alex to see if they have any guns in their homes.
Okay, great. Thank you so much. Really appreciated talking to you today, and please let us know if you need any additional resources as you approach those conversations.
All right, so you can see that Michelle was able to kind of introduce the topic and sort of that three-step approach to get some good information to family regarding access to firearms. So let's jump back to our slides here.
Hey, Joe, I have a quick question. This is Courtney.
Yeah.
I noticed when you introduced the first few skills, like you use the word firearms in one part and then gun in the other. And like, which word is preferred, or like, does that get confusing to families? I'm just curious what your thoughts are on that.
It's a great question. So we've actually, as part of this work with this sort of communication framework, Michelle has been working with various community groups to kind of assess their perspectives on the specific language skills that we're teaching providers, including that question around guns versus firearms. Michelle, did you want to touch base on sort of what we've learned?
Yeah, I'd love to. So I would say overall, people do not have a strong preference for either word. I think that there's some consideration. So the word firearm is more all-inclusive, like archery, bows and arrows, weapons of that sort are included in firearms versus a gun. And then some other considerations were people liked the interchangeability of them. So that's what we've received that feedback. And so we modified to include firearms, then guns, then firearms. The other thing that were some considerations was if children were present, if they wanted to be included in the conversation versus not parentally, like their decision to make. But gun was more accessible and understandable to many people, whereas firearm might not be a word that was understood by a child. So if it was a small child and the parents didn't necessarily want them to recognize what they were talking about in the moment in that conversation, then firearm could be more helpful. So that's just some of the feedback that we've received.
Yeah, that was my big takeaway. And I think in practice that I tend to use firearm a lot when I'm talking with my younger kids about like routine safety. And with my older adolescents, I usually use the word guns. Great question. All right, well, let's keep going a little bit. So we're going to talk next specifically about some safe storage strategies. As already has been discussed, we know that safe storage means that the firearm is locked, unloaded, and ammunition is stored separately. So those are sort of the core tenets that we think about. So when it comes to specific storage devices, there's a few options that families can think about. The first one is going to be a cable lock. So this is like a bike lock. It goes through the magazine well of the gun. They tend to be affordable, usually under $10, which makes them highly accessible to a lot of families. One of the requirements that sort of an advantage from a safety standpoint is that in order to use a cable lock, the firearm has to be unloaded. Of course, it could be cut with wire or bolt cutter, so something for families to be aware of. And it's widely available through a number of retailers, including Amazon, Home Depot, Walmart, Lowe's, and Dick's Sporting Goods. So another device is a trigger lock. So this goes through the trigger guard behind the trigger, preventing it from being pulled. It can be unlocked with a push button, keypad, a combination, or a key. It fits most different types of guns, including long guns. It tends to be affordable as well, usually under $15. Oftentimes it's included with the purchase of a firearm, so a family might already have access to a trigger lock. From a safety standpoint, it blocks the trigger, but doesn't necessitate the loading of the firearm itself. So it's important that if these are used, that they're applied appropriately, because if they're mishandled and loaded, it can lead to an accidental firing. And they're widely available through those same retailers. So we've heard lockbox already mentioned before. I think this is a device that is often preferred by families because it can serve a lot of different purposes. So as you know, it's like a small safe. It can be unlocked with a digital keypad or biometric sensors. And so there's kind of a wide range in terms of the cost of these, from like $25 to $100. They're compact, which allows families to store them discreetly, which is an advantage. It doesn't, again, necessitate that the firearm is unloaded. Of course, ideally, firearm and ammunition would be stored in separate lockboxes. And this is available through their same retailers. The final device we're going to touch on today is a firearm safe. So these can vary in size and level of protection. Thus, they can be much more expensive. They do have some advantages, certainly, is that they're a good option for storing multiple guns, especially long guns. Again, it doesn't necessitate that the gun is not loaded to store here, but it can be obviously difficult to store this discreetly. So other family members are likely to be aware where the firearms are stored. But I think the biggest disadvantage for many families is just the expense of this. Again, available through these same retailers. So just to review briefly, so we have our cable lock. Again, very affordable, requires the firearm to be unloaded to use it. Trigger locks often come with the purchase of a gun, so might already be accessible to a family. Lock boxes, this tends to be often a preferred type of storage strategy for families, though can be a little bit more expensive. And then, of course, firearm safe, which is helpful for multiple guns. One thing we wanted to touch on is the concept of harm reduction when it comes to conversations around firearm safety. So we discussed that ideally, a family would store a firearm locked, unloaded with the ammunition stored separately, right? But for some families, it might be really critical that that firearm is loaded for whatever reason. So in that case, you might want to think about what behaviors would lead to harm reduction. So in the setting of knowing that a firearm is going to be loaded, what could be some recommendations to decrease the likelihood of a accidental or non-accidental injury? So for instance, talking with a family who is committed to a firearm being loaded about using a cable lock might not work as well. So something like a lockbox might be a safer option for a family who is, committed to having the firearm loaded. All right, so we've discussed some of these different skills for introducing the topic of firearm safety with families, and then some specifics around safe storage strategies. So certainly with this conversation, it can be sensitive to parents, and so it can be helpful to use some motivational interviewing skills in order to navigate the conversation. So we're just going to touch on a few here that might have high relevance. As many of you know, motivational interviewing skills help build rapport with families, help families resolve ambivalence, and lead to action. So the first skill is going to be asking permission. So that's exactly what it sounds like. It's asking permission before providing information. So this might be helpful in the case where you have screened for firearms. So for firearms in your home or other homes where Alex may visit, are they kept locked and unloaded? And maybe the family reports that, that they have a gun in the home. They keep it unloaded, but maybe not locked in any specific way. Then you could ask permission. Is it okay if I share with you some ways that we could store the gun to keep Alex as safe as possible? Another motivational interviewing skill that might have relevance here is autonomy. So this really focuses on families' ability to have choice. So after you've introduced some of these different safe storage devices, you might ask, we talked about a number of different strategies here. Which of these might work best with your family? So this allows families to maintain control in this conversation. Finally, affirmative language. So these are statements that help to emphasize a family's strengths, skills, or abilities. So saying something like, after you've had this discussion, saying, I think cable lock, I think the lockbox is a really great option. I really appreciate how dedicated you are to keeping Alex safe. So in terms of our sort of communication skills, we have lots of tools in our toolbox now for talking with families about firearm access and safety. So why don't we go ahead and jump into another case? Any questions anybody had about any of these skills before we keep going? All right. Anyone who wants to give it a go, again, this is a nice low stakes environment to practice some of these skills. It's a safe space. Anyone who wants to give it a try.
I'll do it.
Yay, thank you, Dr. Sumner. I wasn't gonna... You have done excellent in our prior sims on vaccine, so I knew you were well equipped. All right, let me pull up our scene real fast here.
I can't say I'm an expert in storage options, but I will try my best.
All right, let's pull this out. Are you seeing my screen here, Courtney?
Yeah.
Okay, perfect, good. That's weird, it said it was being loaded. Okay, so for this case, you are seeing a previously healthy 5-year-old child named Alex, who's accompanied by his father named Phil for their annual visit. As part of the social history, you learn the patient lives at home with their 2 dads and a 2-year-old sibling. You've reviewed everything with Phil and are now ready to discuss safety and anticipatory guidance. You start with car restraints and then turn your focus towards screening for access to guns in the home.
So we're just starting from the beginning. All right.
Yep.
Well, sorry, what's the patient's name again?
Patient's name is Alex and dad's name is Phil.
Okay. So it sounds like so far you're doing a great job of making sure that Alex is safe in the car. I'd like to talk a little bit about how we can keep Alex safe at home. And one of those things that I like to talk about is firearm safety. We know from like our research that storing firearms locked and unloaded and separate from ammunition is the safest way to keep our kids safe. I'm curious if there are firearms in your home if they're stored safely.
Yes, but we keep it loaded. I bought it to make sure our house was safe in the event of a break-in. We had one of those a few years back, and I felt helpless. It was scary, and I never want to feel that way again. I keep it in the nightstand, so it is easily accessible. But we feel confident Alex doesn't know where the gun is.
Well, I'm really sorry that your family went through such a scary event. We do know, kids are very curious, and I'm sure that you're very dedicated to making sure that Alex stays safe. I'm wondering if you would be open to hearing about different ways that we might be able to store that firearm more safely so that accidents don't happen.
Sure.
Okay. If you prefer to keep the gun loaded, then we have a couple options for storage. The first one would be a trigger lock. Those usually come with the gun when you buy one, or you could consider a lockbox, which would have a code that only you would have access to. Do you think either of those options would work for you?
Do you think we really need one of those?
I definitely think so. Firearms are actually now the leading cause of death for children in the United States. And I think it's really important that we work to prevent any accidents that might happen for Alex.
I'm not entirely sure. I think the lockbox could work. Where do you get a lockbox?
You can get a lockbox at a lot of stores in the area, including Walmart or like your local hardware store or even Amazon.
You're right. I want to keep Alex as safe as possible. I appreciate the information. We will look into getting something to keep the gun safe this weekend.
Great. I'm glad we had this conversation and that you're dedicated to keeping Alex safe.
So good. Yay.
Yay.
This is why we miss you so much at PPC. But that was wonderful. So any behaviors that anyone from the group noticed that Dr. Sumner used that seemed to work quite well?
I thought just, the positive feedback around like what he's already doing well with the child passenger safety. And then I think also taking a stand when the father said, like, do you really think I need this? Like, she said, yes, I do. So I thought that was powerful. There was no waffling back and forth about, well, this or that. So I thought that was really great too. And then, pointing out that, yes, like Alex is very curious, and we both want to keep them safe. And so like, where can we meet in the middle on this to keep them safe? So I thought she did a great job on those pieces.
I also liked how she used empathy when he said how the reason why he had the gun in the home was a previous incident. And she, instead of saying, discrediting that, she like expressed empathy and was like really on board with keeping his decision for his home, while at the same time making it as safe as possible for his son.
Absolutely. Any other thoughts?
I just wanted to piggyback on that. I think that fear is what drives a lot of our families, at least in my practice, to have that gun nearby. And so acknowledging it, and then providing that empathy, because if you feel like your home is safer with a gun, then that's how you feel. And so my job is to work with you to kind of minimize the risk in that setting. So I think that is really important.
I also think that a lot of families aren't sure even why we're addressing firearms in the first place. And so starting off with, in the realm of safety of your child, that, we have fences around pools, we have caps over Tylenol. This is another thing in the home that we're supposed to talk about. And that's why it's so important.
Absolutely. Yeah, that was wonderful. I loved how you talked about how kids are curious, you didn't have a debate with dad whether or not Alex knows where the gun is. We know from like the research that most kids who have a gun in their home know where the gun is. And a surprising number of them have also handled the household gun without their parents' knowledge. But, I think bringing that all up might come across a little bit judgmental. So just mention that, we know kids are curious, especially kids Alex's age. You asked permission to provide information around safe storage strategies, which was really great. And I love some of the affirmative language that you used at the end, sort of those shared values. Like, I know both of our goals to keep Alex as safe as possible. So I really appreciate you, thinking about how we could keep that gun as safe as we can. So
and Liz added in the chat, it also felt like a conversation with the parent, very involved, not like being told, it wasn't one-sided. It was interactive, involving shared decision making with the parent.
Yeah, the other thing that Michelle's learned from her work with the community is that some of those statistics can be really helpful, because we all know that firearms are now the #1 leading cause of why our kids are dying, but not all of our parents know that. And so bringing that in or talking about it in the local community, I know that comes up sometimes in my practice, is like, you've probably heard of some of the things on the news and some of the firearm injuries that have been occurring, and families are like, oh yes, it's like every day on the news. And so I think that brings relevance to it. So it's great. All right, let me jump back to our slides here. All right. So we don't really have to go through these any further, since Courtney gave us a perfect example of all of these skills. So now that our previous cases, which focused on sort of screening for access during routine care to avoid accidental injuries, let's shift a little bit to thinking about more of those high-risk cases. So as we were discussing earlier, access really matters, right? So we know that suicides account for like 60% of all firearm-related injuries, and simply having access to a gun increases the likelihood of firearm-related suicide 3 times. So for this last case, what we wanted to do is take these same skills that we've kind of practiced in the routine care setting, but apply them to a teenager who has depressed mood. Anyone want to give this one a shot?
I can do it.
Awesome. Thank you
Yeah.
so much. Oops. Let me share my screen again here. All right, so for this case, you are seeing a previously healthy 16-year-old adolescent patient named Alex. He's accompanied by his mother named Phyllis for an annual visit. Alex lives at home with his mom and dad. His PHQ-9 score today was a 10, indicating moderate depression. On confidential interview, Alex reports feeling mostly in the middle and denies any suicidal or homicidal ideation. You ask Alex about firearms in the home, and there is one. Alex gives you permission to talk with his mom about his mood and about the firearm in the home. You discuss Alex's mood with mom and make the plan to start therapy through school. Next, you want to talk with mom about the firearm in the house. So whenever you're ready, you can take it from there.
Okay. You said it was Alex and Phyllis, right?
That's it. Yep.
Okay. Okay. All right. All right. Well, I just wanted to share with you, Mom, a little bit about what Alex and I have talked about when you weren't in the room. And Alex has expressed with me some concerns about his mood and kind of feeling down a little bit. Have you noticed, and he mentioned to me there was a firearm in the home. So I just want to talk a little about that. Do you have any, are you okay with me talking about that right now?
Sure.
Okay, so, we know as, pediatricians, we know that the rates of suicide in our kids are increasing, and that most of the time, if there is concern for suicide, the attempt is made with a firearm, and those firearms are often obtained from the home. So I just want to make sure that we're all on the same page here with keeping Alex safe and making sure that we're addressing all the safety issues in the home. So I just want to make sure that if the firearm at home is stored properly. So do you have the gun stored in a lockbox or some other safety device?
Yes, but we keep it
Okay.
unlocked. I grew up with guns in the home. It's what I know. I am familiar with them and appreciate having the freedom to own one if I choose. But we make sure Alex can't get to it.
Okay. And it is definitely, it is definitely your right to own a firearm. And this is not a discussion about whether or not we should be in the home. It's really just a marker of making sure that Alex is safe. So we do recommend that the firearms are stored locked and that they are stored unloaded and that he doesn't have access to them. Children are very curious and oftentimes they know where the guns are, even if, parents think they're properly stored. Just want to make sure that the firearm in the home is stored in a very safe location that he can't get access to. Do you have any questions about that?
We really need one of those.
We do really need one of those. And, research has shown, and we've seen in the last couple of years that there is, with children and with adolescents who are having any kind of mental health crisis, having access to a firearm can really lead to a bad situation. And a lot of kids who think about suicide think about it only for short periods of time before they attempt it. So not having access to that firearm can really make the difference between life and death. So it is really important in order to keep him safe and to keep him healthy that we are locking up the firearms.
Wow, I had no idea. You're right. I want to keep Alex as safe as possible. We will look into getting something to keep the gun safe this weekend.
Okay, wonderful. Well, I thank you for looking into that. And I really appreciate your attempts at keeping him safe because we're all in this together to keep him safe and healthy. Thank you.
This was very helpful.
Yay, great work. Yeah, great. That was a challenging one, right? It was like on an adolescent and a little bit of a different context related, maybe perhaps why the family owned firearms. So what would some of the feedback that the team had around that?
I loved the comment that she made about like this could make such a difference between life and death. Like I feel like that's a really strong statement to make. And I feel like that will probably leave an impression in the parent's mind, like, oh wow, I could really make a difference just by this one simple thing.
Yeah, completely agreed. I think the comment around the time, around the decision making, the legality of it, that brings it, I think, all home for the family and really helps to make them understand why this should be a priority. So that was wonderful.
I really liked, again, the shared decision making and how it was very interactive. I do think, we're saying firearm a lot here, but I do think that when we're talking to families, especially the higher risk families, we have to address all lethal means. I mean, medications are really as important. They're not as fatal, but they're taken very often, and some kids don't know what they're taking. Alcohol is a problem. And so part of the program is discussing all lethal means. So we're using firearm now, but I think that we also have to address some of these other things as well.
Yeah, great point. And I think some of those other like medications, I feel like for me, they seem easier to address, I think.
Yeah.
But I think if you can get the language around firearms, then it's easy to do those other things. And you could even do it in that context, thinking about, making sure medications are stored. Oh, and another thing that can really pose a safety risk for our teenage patients are firearms in the home, and then kind of shift into that conversation. It's great. What else? What other things do people notice?
Dr. Morocco, I thought you did a great job tailoring the counseling of like why you were bringing it up and saying, suicide is rates are increasing just across the board. So I think that helps to like validate and like normalize like why we're having the discussion, how it's relevant in the context of like rising mental health concerns. And then I also liked how, she brought up her right to own a firearm. And you said, you know what, that's like totally fine. It is in your purview. It is your right. It's really a discussion around safety. So let me just redirect in a gentle way and like continue the conversation on so it can be productive. So I thought that was really good.
I agree. That's what I was going to say as well. You did a really nice job of acknowledging, affirming, and moving on to like what our action item is and what our focus is with this particular topic.
Yeah, I agree. I think of that as like a reflect and redirect is what I do in those situations, because obviously debating with families, and this is, I think, applicable to so many things in medicine, isn't super helpful. So saying like you did, like, I certainly appreciate that, you have a right to own a gun. I think, we're here today because we want to keep Alex as safe as possible. Is it okay if we talk about some strategies or ways we could store the gun to keep it as safe as possible? So it's just kind of reflection, redirection. So I thought you did really nice with that. Great. Any other thoughts or questions people had about that case? Great. Let me see here. Jump back to my slides for a moment. There we go. So that is pretty much kind of the end of what we're calling our REACH curriculum. Again, this was a way, hopefully, to practice and build some skills related to introducing the topic of firearm safety. And again, using some motivational interviewing to build rapport with families and help families take action around safe storage. So this is a new curriculum. So we just kind of have started to provide this education to our residents in our continuity clinic and would love any feedback. So we haven't done as much in the large group setting like this. So please feel free to scan this QR code and just give us some brief feedback around how this experience was and how we can improve it for others moving forward.
Great, thank you all so much. And then that gives us, we have about 10 minutes left. So if you have questions, or, you've been having some of these conversations with families, if there are particular things that have been challenging, please feel free to ask those now, and I will be following up with all of you via email with the slides, the recording from today, how to claim your CME and MOC credit for today's presentations, and then next steps for the Impact Education project. But feel free to ask questions or offer comments in the time we have remaining.
Wow, I had no idea.
Whoops, sorry, that was one of the avatars. Sometimes they talk spontaneously. It's very scary in my office sometimes.
and also maybe like sharing any experiences you've already had around these conversations, like whether it went really great or really not great.
This was wonderful. I love doing virtual reality sessions. I had a question just based on like my own experiences, especially with like toddler, like preschool, beginning school age, I've been tending to use the word firearm, and a lot of times the kids will jump in and they'll be, well, what's a firearm? What's a firearm? And I don't really know how to approach that situation. Like sometimes the parents will jump in and they'll tell them what it is. And then sometimes I feel like they get kind of reserved and don't want the kid to actually know what we're talking about. So I'm just kind of curious if anybody else has had a similar situation and like how you tend to approach that.
Yeah, it's a good question. I think often I love that you're talking about it at young ages, because we know kids like as young as 2 and 3 can overcome the trigger strength. So, and I think from Michelle's work, we've learned that like most families are cool with that, right? And the earlier we introduce it, the better. I think often I sort of like read the room a little bit. Like I usually will use firearm again with those younger kids and then get a sense of like, most parents are pretty open to it. A lot of kids, I feel like, if the parents don't think they don't know what a firearm is, they very well could be. But I think if the parent, I'm trying to think of the best way, if the kid asks, oh, what is a firearm? I'm trying to think what I would say, like, oh, it's just something that we want to make sure that, I'm just talking to your parent or your mom about, keeping you as safe as possible or something like that, just sort of like kind of redirect them a little bit or in some capacity. But I know that could like interrupt the conversation or flow with the parents. So I don't know, what do other people, has anyone else encountered that, or what have they tried?
So Courtney, I think that's where bundling risks together is really helpful. So when you're sitting there and you have an incredibly curious toddler, you could say to the family, objects that fit inside a toilet paper roll probably need to keep out of their wrist for ingestion purposes. If you have a pool, having a fence is really important. If you have things like medications or firearms, you want to make sure that there's a barrier. Here's some ideas. When you do it in that sense, the kid usually kind of gets bored of all of those things, but the family understands it and they're not going to pick out just firearm. When you just talk firearm, then I think that the kid's going to be a little bit more inquisitive.
I think that to both those points, I think from my experience when I've had that come up in clinic, Courtney too, I've tried to redirect by saying like, oh, it's just something that some people own sometimes. And I just like to check in to see if your family has one and just move on and not even define what it is in that moment with the toddler, and redirect with like, check out this cool light, or, because their attention span's relatively short, but then kind of as I'm listening to them or doing my exam, talking to the parent at the same time to circle back to that conversation. So I don't actually define it if, mom or dad or the parents don't feel like talking about it in that moment. One other interesting point that came up in some of the community focus group work that I've been doing was this exact point around some families want it brought up and normalized and discussed at all visits, and others felt like, I would like the option to have like a pre-screener that I could say like, it's part of your safety checklist that every clinic asks, but then as specific to firearms, like, would you like to discuss this in the presence of your child today? Yes or no? So that at least that information is being shared ahead of time to kind of help guide and navigate the conversation so that it doesn't end up in that situation where they're kind of like, oh gosh, I didn't expect them to bring this up today. But again, every clinic functions differently and like questionnaires are different, each individual location, but that was just one thing that had been brought up as a point of discussion.
Yeah, and I think that often as clinicians, we feel if we bring something up that they were putting the patient at some risk related to it, right? Like they're going to go look for the firearm now. And I think what we've learned is with like firearms and with like suicide prevention, that is not the case. Michelle and I were talking about an article that came out this month in JAMA Pediatrics it was in Ohio, it used a video targeting children around firearm safety. And it showed that like when they were put in a simulated setting, they were less likely to interact with the firearm. And that focused on kids like, I think it was 5 to 12 years.
8 to 12.
8 to 12. So a little bit older than toddlers, but.
I also think it's important, and part of this program is that it doesn't matter if you're a higher risk. It doesn't matter if the child has been diagnosed with depression, that at any given time, any one of these kids is impulsive. They say that 25% of kids are depressed at any given day. So these discussions really have to happen with every child. It's not just the high risk kids.
All right, were there any other questions or comments? All right, well, thank you all so much. We appreciate all of your time today and you taking on this really important project. And thank you again so much to our colleagues in Cincinnati for using the virtual reality platform. I think that's so helpful. And kudos to our volunteers for jumping in and practicing. You're going to get a little extra something in your resource box. So thank you for doing that. And I will be in touch via email. So look for that. And thanks again, everyone, for all your hard work on this today.
Thank you.
Thanks, everyone.